Hi, I'm Dr. Rob Cushman, the Acting Medical Officer of Health for the Renfrew County and District Health Unit. Again, today I have a very important message for you, and the message is how important it is that we vaccinate children between the ages of 5 and 11. Now, we've vaccinated over 1,000 children already, but the concerning piece is that only 1,000 additional children have registered for vaccines in the month of December. And we think there's 7,000 kids out there who could be vaccinated. So that means that we haven't heard from 5,000 children from their families yet. And I just heard Dr. Vera Etches from Ottawa saying that they've got roughly a third of the children in this group vaccinated already, whereas we're hovering around 11%. So there's work to be done. Now, let me tell you, we've seen a dramatic increase in COVID cases in children of this age group, the 5 to 11 age group, since September. And in fact, this is the most this is the most affected age group. This is where we've seen most of our cases. We've 36 cases, probably counting even today, since Labor Day, since early September. And that's almost 1 in 5 of all our cases. So this is serious. Now, you might say to me, well, you know, children don't get really sick. But in fact, there have been 300 hospitalizations in Canada, 50 ICU admissions, and 2 deaths for these kids. And as Dr. Malinowski from Barry's Bay has reminded us, if your child does need admission, they will have to go to CHEO. And that's a long drive, and in particular at this time of year. So on top of all your worries, you have to deal with the drive. Now, we've seen over the past few weeks, we've seen cases in a number of schools, on hockey teams. And the thing that's very interesting with this is that it can really tie a family down. I mean, if you have a child who's a case, it basically means that you're going to be at home for quite some time, and it's going to have a major impact on school, on work, on your social life, on your recreational activities, on whether or not you can play hockey, for example. The other thing we've noticed is that Delta variant spreads very rapidly in a household. It's rare that we see someone in a household remain uninfected, and that includes vaccinated people, older siblings, and parents. So really, it's very important because if you are in close contact and you are, you have to isolate, and it can really tie things down for quite a number of days. Close to 2 weeks, in fact. And the good news is, in fact, if you are vaccinated and you are not symptomatic, you can carry on with what you do, school or work. But if you're unvaccinated and even asymptomatic, you have to stay home because we've seen such rampant spread within families. Now, look, this is a very safe vaccine. It's only 1/3 the dose we're giving to older children and adults, the Pfizer vaccine, and they've now delivered over 4 million vaccines to children in the 5 to 11 year age group in the United States. And there have been no significant safety concerns. And in fact, the concern about heart problems, myocarditis, is much less in this age group, significantly less. So what was a rare condition and one that basically resolved within weeks or a month or so, we're not even seeing that in this younger population. We may well see it eventually after we've administered millions and millions of these vaccines, but it's very rare. So by and large, we're seeing a lot of cases. I think our caseload right now is probably worse than it was a year ago, even with vaccines. And that speaks to how wily this Delta variant is. And of course, we're worried about this new variant, which can spread very readily. But we see that vaccines, from what we know now, can protect people. So my message is that everyone needs to get vaccinated who has not been vaccinated. Third doses for those who need them at this point. But really, the 5 to 11 year age group, when you see that Ottawa has 3 times the percentage of kids in this age group vaccinated already, you see that we're really trailing. And winter's here, we're spending more and more time indoors. And the best approach in this pandemic, without a doubt, is to be vaccinated. It's your best defense. And with Christmas and the holiday season approaching, Really, I think the best present you can give your family is the vaccination. And it's that way that you'll keep family safe over Christmas and you'll be able to get together and have some fun. So on that note, if you're parents of young children who are eligible for vaccination, please sign up to get your children vaccinated. And if you haven't been vaccinated yourself, do the same. It's the best way to protect us. We see this time and time again. We see that if you're vaccinated, you have 1/5 the chance of getting the disease, 1/11 the chance of getting the disease that requires hospitalization. So if you're vaccinated, it's basically like a cold for most people. But this is how we can reduce the spread and protect ourselves. Thank you.